All right, now we're going on to chapter 18. This is general pharmacology. What we'll be talking about, we'll talk about medications an EMT can administer, EMTs assisting with prescribed medications, general information about medications, and assisting with IV therapy. Excuse me, medications EMTs can administer. This is a list. We can give aspirins, oral glucose, oxygen, activated charcoal, and naloxone or Narcan. There's a picture of a bottle of chewable aspirin. Here's the oral glucose. Comes in a tube or tube-like shape. Oxygen, we talked about already. This is activated charcoal. And naloxone is an antidote for a patient who's unconscious and respiratory failure after taking a narcotic. Does not work if a patient didn't take a narcotic. Assisted EMT assisting with prescribed medication. These are bronchodilators, inhalers. This would be like albuterol and Symbicort and all these others. Prescribed medications like inhalers or nitroglycerin or epinephrine. Used bronchodilator or inhalers are used in patients with asthma, emphysema, or chronic bronchitis, COPD. Enlarged constricted breathing tubes. Side effects, they'll increase their heart rate and they'll make the patient a little jittery because they're steroids. Nitro, it's often prescribed for chest pain. It'll come in a spray, it can come in a tablet. Taken by a patient with a history of chest pain or cardiac origin. What nitro does is it dilates the coronary vessels, so more blood flow will get to the heart. Contraindications are low blood pressure or taking medications for erectile dysfunction, like Viagra or similar products. Side effect, it'll drop their blood pressure because it's going to open their vessels, so of course the pressure is going to drop. Uh, Epi auto-injectors or EpiPens, they're prescribed and used for patients with severe allergic reactions, classified as anaphylaxis. They are vasoconstrictors, so they relax the smooth muscles and the airway passages. Side effect, increased heart rate and blood pressure, because like I said, these are steroids. Well, not steroids, but they're affect your sympathetic system, so your heart rate's going to go up, your blood pressure's going to go up. Force protection medications, atropine auto-injectors to treat responders in the event of an attack. General information about medications. What we're going to find is that each drug is listed by its generic name. Each drug will have at least three names, but either its chemical name, its generic name, or its trade name. One or more trade name given to a drug by manufacturer. So, for example, a generic name would be aspirin, trade name would be Bayer. What you need to know before giving a medication, the indications or why we should be giving it. Contraindications is why we shouldn't give it. Side effects are what could happen if we give this drug, and untoward effects that we don't know may happen. How is medications presented? There's different forms of medications. We got a compressed powder or tablets. You got liquids. You got gels, suspensions. That's usually suspended in like water. Fine powder, gases that would be like your inhalers, and sublingual sprays that would be like your nitro under your tongue. Sublingual. Medication safety and clinical judgment. Administer and assisting with medications is a serious responsibility. We have to know the medication and use our own good judgment. Medication authorization. We have offline. This is where you don't have to speak directly to a doctor. These are your standing orders or your protocols. But if we have questions, we can go to online medical directions where we speak directly to a physician. We're going to listen to the orders and repeat them back and ask for clarification if necessary. So if the order doesn't make sense, we may ask the doctor to clarify it a little bit. The 5 rights, these are, do I have the right patient? Is it the right time to administer this medication? Like if we're assisting their prescription and they're supposed to take it 3 times a day, is it the right time to give it? Make sure it's the right medication, the right dose, and the right route. So if it's something that's supposed to be a chewable tablet, we crush it up and try to atomize it, that's not the right route. Routes of administration, we can go through oral or swallowing it. Sublingual is dissolved under the tongue. Inhaled, you're going to breathe it into your lungs. This is usually the atomized or aerosol particles. Intranasally, we're going to spray it into the nostril. And intravenous will be injected into the veins. Intramuscular is injected into a muscle like the EpiPen. Subcutaneous is injected under the skin, or we call it sub-Q. Interosseous is injected into the bone marrow cavity. This is the IO that you will do at an advanced level. Or medications can be given endotracheal or sprayed directly into the tube that's inserted in the trachea. Pharmacodynamics. Pharmacodynamics is the study of the medication on the body. What effects will this medication have? And how it affects certain patients specifically. And patient-specific factors can change on how the medication works, like weight, age, other medications they're taking, and so on. Reassessment and documentation. Remember, if we give a medication, we're going to reassess the patient afterwards. Most of these drugs, you will do a reassessment like 3 to 5 minutes later. And we're going to clearly document in our PCR that we gave this medication, when we gave it, how much we gave it, how we gave it. Some medications that patients often take. This is Advair. It's a inhaler. Here's some other medications that are herbal agents. Assisting with IV therapy. Setting up an IV administration. IV means we're going to give it into a vein. You'll have a heparin or a saline lock on your IV. The catheter is placed in the vein. That's the actual IV. Then this heparin or saline lock is placed at the end of the catheter. And this way the patient doesn't bleed out. And this lock will have a one-way valve or port for giving the medication. So we can administer medication to the IV where it goes in, but it won't come back out through this lock. If we're going to do a saline infusion or an IV bag, it'll hang over the patient. It's gravity fed or gravity flow. And it's a constant flow of fluids or medications into a patient. Clear plastic tubing will connect the bag to a needle or a catheter, like an IV. So the saline tubing will be clear plastic. We have 3 important parts to this tubing. We'll have a drip chamber that goes on the top by the bag. A flow regulator is just it's a pressure flow it's like a roller that we open it up, it'll flow more. We close it down, it'll squeeze on the tube and slow down the flow rate. And then you need a drug or a needle port. This is a part to the saline bag to where we can actually inject other forms of medications. And I say I'm talking about higher level providers like advanced EMTs or paramedics. Extension sets make it easier to carry or disrobe patients without pulling out the IV. Here's a picture. He's inspecting the bag, make sure the saline is what was ordered. If it's clear, no leaks, it's not expired. Setting up the IV administration set includes removing the plastic covering from the port of the fluid bag and spiking the bag with this tube. Here you see him spiking this plastic needle like into the uh, port of the bag. He opens the flow meter so that the tubing will start filling with the fluid. And once it's full and all the air's out, we'll shut this by rolling this flow meter up. It puts pressure and it clamps off the tubing completely. Troubleshooting flow problems. Make sure that the constricting band wasn't left in place. Make sure that our flow regulator is left closed. Making sure that none of the clamps on the tubing are closed. The tubing can get kinked pretty easily, so we have to track down the tubing and make sure it's not kinked. Or the patient may be laying on the tubing, right? And the weight of the patient kinks off the tubing. You can adjust the flow properly. This will all be done by higher level care. And you're going to monitor the IV site for infiltration. This means that for some reason, either the IV has come out of the vein or the vein has actually ruptured, and now all the medication or whatever is going into the tissue, surrounding tissue, instead of in the vein, what should be. Chapter review: aspirin, oral glucose, oxygen, or medications that EMT administer to a patient under specific conditions that we carry on an ambulance. The EMT may assist patients in taking prescribed inhalers, nitro, and epi auto injects. You may be able to administer intranasal naloxone or Narcan. You may need to have permission from medical direction to administer or assist the patient with medication. Follow your protocols. There's a wide variety of medications that a patient may be taking. You will try to find out with medications patients taking with your sample history, right? Remember what your sample is. These drugs may be identified by a generic or trade name. Your main purpose in finding out what medication the patient is taking is to report the information to your medical director or hospital personnel. When we are giving medications, the first check is the expiration date. Keep those 5 rights in mind: right patient, right medication, right dose, right route, right time. And we're going to fully document all medication administrations as soon as possible. EMTs administer aspirin, oral glucose, and oxygen as part of their care. They may assist with prescribed inhalers, nitrogen, and EpiPens. They should understand the names, indications, contraindications, side effects of all the medications they're going to intend to administer. Must have the appropriate authority to give a drug and must follow the 5 rights. Reassess and document are elements of medication administration. All right, that'll do it for a very brief and general pharmacology. Your instructor, as I will my classes, usually go into more detailed medications that their students are allowed to do in their area. So until we will see you with chapter 19.